A pleasant good day to the viewers of Tobago Inspirational Network. Yours truly, Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. So we usually have discussions on health, integrative health. At Batson and Associates, we are trained consultants in what is known as natural and integrative medicine. A lot of persons ask the question, well, what is natural medicine? What is integrative medicine? And they automatically assume that we're discussing herbs, and that's not in fact the case, because when you look at nutrition and what nutrition really encompasses, nutrition encompasses a number of things. It encompasses vitamins, so like your vitamins A, B, C, D, E. It also encompasses minerals, calcium, magnesium, zinc. It also encompasses what is known as phytonutrients. The prefix there, phyto, standing for plant nutrients, and that is broad, nutrient-dense food, so things like CMOS, that type of thing. So as an integrative clinical nutritionist, what we are really trained to do is really help persons with diseases, ailments, to really bring back balance into the body, because that's the main purpose of what the body is designed to do. The main purpose of the human body is to maintain equilibrium, balance, homeostasis. All those three words mean the same thing. Essentially, when your body is out of balance is when you end up ill. Now, you might hear persons saying, if I have diabetes, I have to live with diabetes for the rest of my life. You might hear persons say, if I have arthritis, I have to live with arthritis for the rest of my life. You might hear persons say, I have high blood pressure, and my mother had high blood pressure. It is something that runs in my family. So as a result of that, I am doomed. I have no other choice but to end up hypertensive. That is not the case. There's a saying, as a practitioner for the past 15 years, one of the things I tell persons, we often say genetic load the gun, but lifestyle pull the trigger. And I'll explain to you what that means. So today, we're gonna have a discussion about two health topics, and we're actually gonna discuss something that affects a number of persons. We're going to discuss what is known as arthritis, because you have many different types of arthritis. So we're going to touch on rheumatoid arthritis, and we're also going to touch on osteoarthritis, and we're also going to speak about gastrointestinal problems. So we're going to speak about persons who suffer from acid reflux, where you have burning, you feel as if it is, you're getting pain in your left side. Some persons have actually been rushed to hospital thinking that they're actually getting a heart attack because of how detrimental or how deadly acid reflux attacks feels. And of course, when you go to the hospital and they look at the cardiac enzymes, they realize you didn't have a heart attack and you actually have a problem with acid reflux. So we're going to discuss what is acid reflux, who are most affected by acid reflux, and of course, what can you do from a natural and integrated perspective to really address the situation of acid reflux. Good. So when we're speaking about arthritis, what really is arthritis? So this is all the persons who are having problems with pain. So you might have pains in your knee, you might have pains in your ankle, you might have pains in your shin, you might have pains in your waist, you might have pains in your back, you might have pains in your neck. Now, the musculoskeletal system comprises your bones, tendons, ligaments. So arthritis is a disease or imbalance in the body that affects the musculoskeletal system. So when we're discussing arthritis, what we're really speaking about? So arthritis is as a result of inflammation in the body. Now, or what is known as excessive inflammatory response. What is inflammation? So inflammation is a normal response in the body. I'll give you an example. So let's say you bounce your hand, or let's say you fall and you hit your head, or you bounce your shoulder or something. What's going to happen? It's going to get swollen, it may get red, it may get bruised, and it's going to feel a bit of pain. Now that is normal because that is your body's natural inflammatory response. So the body is supposed to respond in a way like that to ensure a number of things. One, to ensure that that inflammatory response is blocked off there or cordoned off and it doesn't spread to other parts of the body. And the inflammation is also there because your white blood cells come together and it starts to clean the area and it starts to do what it is supposed to do. And that is a normal response in the body. What makes it problematic is when you reach a stage where the inflammatory response is excessive. And that is exactly what causes arthritis. Now, when we're looking at rheumatoid arthritis, for example, what is rheumatoid arthritis? Rheumatoid arthritis is actually parasite in your bones. So I'll repeat it. Rheumatoid arthritis is parasites in your bones. Now, of course, the question that's going to come to mind is, how did parasites end up in your bones? And we're going to discuss that. But then osteoarthritis is a form of arthritis, but it has an issue where you have or you lack density in your bones, because your bones are comprised of calcium, magnesium, and phosphorus in the form of calcium phosphate. So an individual who has osteoarthritis, you have the swelling, you have the pain, but the issue is, in this particular case, is that you have an imbalance as it relates to calcium, magnesium, because your bones, as I said, are calcium, magnesium, and phosphorus in the form of calcium phosphate. So someone who has osteoarthritis, they actually have an acidity problem. And we'll discuss that a little later on in detail as we continue. So let's go back to what we were saying with rheumatoid arthritis. So I just said that rheumatoid arthritis is parasite in your bones. Now, where do parasites normally live in the human body? Parasites is normally found in your gut or your intestines. Now, there's a condition known as leaky gut syndrome. And leaky gut syndrome is a condition where you actually have holes in the small intestines, because based on the laws of anatomy and physiology, the most amount of digestion takes place where? In the small intestines, right? Now, the thing is, the small intestines is like a strainer. And what it does, it allows food to go through the strainer and go into where? Your bloodstream. And then, of course, the blood is going to transport oxygen, nutrients from all this food that you just assimilated into various parts of the body, including your bones. Now, red blood cells are produced where? In your bone marrow. Good? So the thing is, people who have rheumatoid arthritis actually have serious gastrointestinal problems, which allow those parasites to leave the gut, leave the intestines, and go into the bones. And that is primarily what rheumatoid arthritis is. So the question now, rheumatoid arthritis, we know, is very debilitating. It causes a lot of swelling. It causes a lot of pain. It is very difficult for persons who have rheumatoid arthritis to remain mobile. Now, Western medicine, doctors would normally recommend painkillers for you. They normally recommend some sort of inflammatory steroids. So you normally would be recommended things like prednisolone and that type of things. Now, the issue with that is that it doesn't really address the root cause of the problem. Now, it is going to help you to some extent in managing the issue. But again, it is a plaster for a sore, and it is not addressing the root cause of the problem, which I just explained to you there. So the thing is, if you have parasites in your bones, then you need to do something to ensure that you get those parasites out of there. Because remember, all parasites or all living organisms do what? They eat and they excrete. So it means now that they're literally taking all the nutrients from the body, from your bones, but they're also excreting in your bones. So it means now that that is one of the reasons why people end up with inflammatory conditions. So a perfect example, even though we're not discussing it right now, is lupus. Lupus is known as an autoimmune condition. MS, which is multiple sclerosis, is also known as an autoimmune condition. Diabetes, autoimmune condition. Fibromyalgia, autoimmune condition. So there are a lot of autoimmune conditions. There's also something known as connective tissue disorder. All of those are indications of serious gastrointestinal imbalance. And at Batson and Associates, one of the things that we train to do is bring back balance to that gastrointestinal system. There are a number of ways we would do that, but of course, we have to assess you first. And that is where the live nutritional blood cell analysis comes in. Viewers would have seen some of the programs that we had before, where we actually showed the consultants where they were actually taking the blood, putting the blood on the screen. And the thing is, a trained consultant actually has the ability to determine levels of inflammation in the body. Now, one of the things that we will do is once we determine the inflammation is high, we can also send you for an additional blood test known as an ESR. Now, an ESR stands for erythrocyte sedimentation ratio. Now, what medical practitioners are supposed to do with an ESR is determine where your figures are. And then, of course, at Batson and Associates, we're going to work with you to ensure that we bring down that ESR. Now, I'll tell you why inflammation is so dangerous to the body. If you do a blood test, that same ESR, or you come to Batson and Associates and we do the magnetic resonance analysis scan on you, which is a scan that looks at the body in its entirety. We look at different organs. We also look at the musculoskeletal system. We would actually be able to see the level of inflammation in the body and now make specific recommendations to assist you in reducing those. So that's something that you need to pay attention and keep in mind. So those of you who who viewing the program would actually be in some cases affected by arthritis. So your knee always swollen. We know the weather, so a lot of you could tell us when rain is coming, and that's the reason for that is because of all that inflammation in the joints. So if you're someone who viewing this program and you want help, feel free, of course, to give us a call or visit that telephone number and location. Again, you can give us a call on 222-8261. That's 222-8261, and WhatsApp us, on 314. That's 314-9975. That office again is located at the Triangle Building in Scarborough, Tobago. It is opposite WASA. Very easy to find, and again, those numbers for Tobago is actually going to be placed below this program. So that's one topic we discussed. So we discussed rheumatoid arthritis. So the next one is osteoarthritis. So as I said before, when you're dealing with osteoarthritis has to do with poor density or poor bone density. So I'll give you an example. So you would want your bones to be as dense as, imagine a glass that is filled with sand. Now, if you have a glass that's filled with sand, you'll realize that sand is very close or compact. So that is more dense, as opposed to a glass that is filled with marbles. The spaces are going to be much larger. And if you have much larger spaces in the bones become less dense, and as a result of that, the bones essentially become brittle. So you usually find when people get older, especially women, because remember, women, because of estrogen, because of hormonal imbalance challenges, because of problems associated with losing minerals during childbirth, or they would have experienced loss of bone mass, and as a result of that, you find it's very easy for women to end up with osteoarthritis. So how do you fix that? Now, remember, at Batson and Associates, we are specialist consultants in integrative medicine. One of the things I mentioned to you is that rheumatoid arthritis has to do with parasite in the bones, but osteoarthritis has to do with excess acid in the body, because in order to neutralize our acid, you need a base or alkaline. That's simple chemistry. The most readily available alkaline in the human body is what? Calcium. Calcium is stored where? In your bones. Your bones are the warehouses for calcium, and the thyroid gland is responsible for telling the brain how much calcium to take from the bones to keep your blood alkaline. Good? So an individual who suffers from acid reflux or lactic acidosis is going to actually have a situation where, because of consistent amount of high acid in the body always starts to try to compensate and break down that particular acid in the body. So as a result of that, you end up losing a lot of calcium from your bones, because remember, your bones are comprised of calcium, magnesium, and phosphorus in the form of calcium phosphate. Good. So our time is very close. One more thing I'll touch on very quickly is what I discussed as regards to acid reflux. Now, acid reflux is also known as GERD, which is an acronym for Gastro, G, Intestinal. So it's Gastrointestinal reflux disease. And in a particular case like that, you have excess acid that actually leaves the esophagus, or leaves the stomach rather, and comes up in the esophagus and cause problems with burning. You can feel like it coming up in your mouth. When you're sleeping, you have to lie down on 3-4 pillows because you have a lot of burning there. Now, there are a number of things that we do at Batson and Associates to address that. But you know, we always tell persons, yes, you can buy products from us. So we have things like the Digestive Restore. We also have Digestive Balance, which are two products that actually help, one to break down your food and the other to actually assist in regulating the digestive system. And you can get any of those at Batson and Associates. So feel free, of course, to give us a call or visit. That office again is located at the Triangle Building in Scarborough, Tobago, opposite WASA. Those telephone numbers, again, you can give us a call on 222-8261. That's 222-8261, or WhatsApp us on 314 314-9975. Again, that's 314-9975. You have been listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. And as we always say, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Good day and enjoy the rest of your day. Take care, guys.